Good morning. Good morning. My name is Nathaniel Smith, and I serve as the founder and chief equity officer of the Partnership for Southern Equity. I am so encouraged and really truly inspired by the numbers of individuals who have chosen to spend their valuable time with us this morning. You have zoomed into the first in a series of webinar discussions that the Partnership for Southern Equity will be having with our partners, ARCHI and other important partners about health equity. And the webinar series is entitled Health Equity, the Urgency of Now. This specific one, the kickoff of this series will focus specifically on the urgency of naming racism. And we will be honored, of course, to have Dr. Camara Jones speak to all of us today. Why do we have to begin with naming racism as it pertains to health equity? Because if we look at it within the context of the social determinants of health and how our environment influences our health outcomes, we have to understand that while other aspects of our social determinants affect the health of our communities, and in particular, vulnerable communities and communities of color, housing affordability, transportation, infrastructure, environmental quality, there's one determinant on many occasions that we forget, and that is racism. Racism is a social determinant of health. And what we've learned from these past few weeks, whether it be through the COVID-19 situation or the uprisings that we see around the country, that we believe as an organization, the Partnership for Southern Equity, that racism, in being a pandemic similar to what we're dealing with COVID-19, is the number one killer of Black people and communities of color in America. And so if we don't solve the challenges that we face around racism, we will never be a truly healthy society. And with that being said, again, I'm so honored and appreciative that you all have chosen to participate in this webinar. And I encourage you to learn about the various partners that have engaged in this series. We hope to see you at all of the webinar series that we will be putting on with our partners. And thank you again for participating. I now want to hand the ball off, so to speak, to a dear friend and partner in this work, Miss Robin Nicole Bussey. Robin works at ARCHI. She is the community health strategy for ARCHI, where she works with community residents and organizations in Fulton and DeKalb counties to name their community health and wellness journey and to leverage their assets. Of course, she's committed to highlighting and addressing the persistent inequities that impact communities of color, and which means a substantial number of people of color in our region. I'm also honored to say that Robin is one of the inaugural members of the Partnership for Southern Equity's Just Health Circle, and has been a critical component as well of PSC's Just Growth Circle for many years. And now she has stepped up to help us to organize our Just Health Circle. So again, Robin, thank you for participating, and I hand the ball off to you.
Thank you so much, Nathaniel. I greatly appreciate the honor of being a part of the Just Health Circle and being here with you all this morning. And it's also an honor to be able to introduce our dynamic speaker for today. And as Nathaniel said, this is the first of a 4-part series. And as we kick off with the urgency of naming racism, which of course we could not start without doing that, and we have to, again, undergird how urgent it is to name it before we get into what we need to do about it. It's only fitting that we launch this series with our dynamic speaker for the morning, Dr. Camara Jones. It is highly unlikely that she needs an introduction, but I will give a very quick one so that we can get to why we're virtually gathered here today. Dr. Camara Phyllis Jones is a family physician and epidemiologist whose work focuses on naming, measuring, and addressing the impacts of racism on the health and well-being of the nation. She is a past president of the American Public Health Association and was the 2019-2020 Evelyn Green Davis Fellow at the Radcliffe Institute for Advanced Study at Harvard University. She is taught at the Harvard School of Public Health, Morehouse School of Medicine, and Rollins School of Public Health, and serves as a medical officer at the Centers for Disease Control and Prevention. Her allegories on race and racism illuminate topics that are otherwise difficult for many Americans to understand or discuss. Recognizing that racism saps the strength of the whole society through the waste of human resources, she aims to mobilize and engage all Americans in a national campaign against racism. So before we get started, just a little bit of housekeeping. Please enter any questions you have in the Q&A portal. You should see the button at the bottom of your screen, and we will do our best to get to all of them. And before I get out of the way and get to why we're here today, to Dr. Jones, we have a couple of poll questions we want to get started with. So we'll go ahead and get started with those, and then we'll get started with Dr. Jones.
So can we launch the first poll question? So the questions that we're launching right now, they're all together. So I guess we can just do it that way. How many answers are coming in? Do we have all 195 people responding?
Can't tell yet. I'm sure we will find out in just a moment.
And maybe while you're voting, I will just read them out. So the first question is, what is racism? The responses are historical injustices that are no longer relevant, or an individual character flaw, or white supremacist culture, or a system of structuring opportunity and assigning value, or an excuse for lack of effort. The second poll question is it important to name racism? And the responses are yes, or no, or depends. The third poll question is, how often do you think about your race? Where the answers could be never, once a year, once a month, once a week, once a day, once an hour, or constantly. The fourth question is, what do you consider to be the most important element of decision making? Is it who is at the table? What is on the agenda? Written policies, unwritten practices and norms, or underlying values? And the fifth question is, which of these principles do you consider to be most important in achieving health equity? Would it be valuing all individuals and populations equally, recognizing and rectifying historical injustices, or providing resources according to need? And so, as you can tell, there's no right or wrong answer in any of these questions. These are poll questions. We'd like to get your opinions. They will help inform not only how I respond and shape my talk, but also perhaps what the Partnership for Southern Equity and the Just Health Circle and this ongoing webinar series and the Two Georgias initiative and everybody, ARCHI, like how we might shape the work going forward.
I think we'll be closing the poll soon. We're still getting a few responses.
Will the answers be able to be broken out answer by answer?
Let's see. I'm sure they can.
Okay.
Mm-hmm.
I know it's taking a long time for people to push submit because there are 5 questions. So I'm new at this, and so I was trying to have it so that each question would come up separately. So my apologies for that. But
Let's see. So maybe we give it another few seconds or so. And then we close. She's about to close the poll.
oh, so I would like to just read the results out loud. So what is racism? 85% said that it's a system of structuring opportunity and assigning value. 10% described it as white supremacist culture. 3% said it's historical injustices that are no longer relevant. And 1% each described it as an individual character flaw or an excuse for lack of effort. So I will be talking about my definition of racism, and it's really useful to see those results. Is it important to name racism? 98% said yes, and 3% said depends. On the third question, how often do you think about your race? 41% of the people who are listening to this webinar and responded to the poll right now said constantly. The next group said, which was 33% once a day and 10% once an hour. So if you add all that up, 84% of people listening to this webinar today think about their race once a day or more frequently. Then 9% think about their race once a month, 8% once a week, and just 1% each for never or once a year. What is most surprising often for people is that not everybody says the same thing they said, that the answers are spread across the whole spectrum. And actually, if we could see each other, I used to ask this question 25 years ago every time I do a talk. And then I'd ask people to raise their hand with their answer, and what would look like would be a color wave. So I think that this is quite interesting. And it also gives me a sense of who's who's here right now. In terms of the fourth question, what do you consider to be the most important element of decision making? And of course, there's no one right answer here, but it's interesting that 41% say who is at the table, and 36% say underlying values, with unwritten practices and norms, which is kind of culture, at 14%, written policies at 8%, and what's on the agenda at 3%. That's also very, very informative. And then finally, fifth, which of these principles do you consider to be most important in achieving health equity? It was kind of a little even, but 45% say recognizing and rectifying historical injustices, and then 30% say valuing all individuals and populations equally, and 28% providing resources according to need. Thank you very much for answering those poll questions. It's the first time that we've launched that. It might be interesting at each of the subsequent webinars to maybe do the same poll. See, some of the people will be here all the time. There might be new people, but people's ideas might change as well. So thank you very much. That's great. Okay.
Absolutely. So we're going to get started. I'm going to launch a question at you, Dr. Jones, and
Sure.
take it away. So our first question is, what has COVID-19 revealed about health inequities in the United States today?
Okay, I am going to actually launch my slides to answer that question. But the first thing I have to say about that is that COVID-19 has unmasked again, I would say, structural racism in this country. And the reason that I say unmasked again is that that we've had other. So racism is foundational in the nation's history. It's doing everything. It's doing the differences in health outcomes. It's doing the differences in educational achievement, the disproportionate incarceration of Black folks and brown folks in our prisons. All racism is underlying all of that, and people have sort of gotten numb, and they just sort of think that's just the way. It just so happens that this is what we're seeing, or that those people must be lazy or stupid. But with COVID-19, It was clear that there was no human on this planet that was immune to this virus in December of 2019. And if opportunity were equally distributed, at least in this country, and if exposure to risk were equally distributed in this country, there should be no way that we could slice and dice the population and see any differences in the numbers of people getting infected or the numbers of people dying from this new virus. So when the data finally started being released about the race-associated differences, the fact that communities of color were disproportionately hit by this virus, that was, I think, the bodies, the black and brown and indigenous bodies were just piling up so fast that their excess could not be normalized. Their excess could not be ignored. And all of a sudden people were waking up again and saying, oh my God, there's something structural going on here, and naming racism. So what I want to do is talk about the urgency of naming racism, but not just now, I would say again and still. And what I hope is that we will not, in 6 months, forget that racism is operating in this society as manifest through COVID-19, as manifest by the highly publicized right now killings of black and brown men and women, you know, vigilante groups, police officers and the like, that we won't fall back into what I describe as the sleepiness or the somnolence of racism denial, but that we will keep racism on the agenda. I actually intend that we should launch as a nation the same national campaign against racism that I launched as president of the American Public Health Association 4 years ago, where there are 3 tasks: to name racism, to ask how is racism operating here, and then to organize and strategize to act. So I like to do storytelling, and these days I am using this very short allegory, dual reality, a restaurant saga, which was based on something that I experienced in my own real life. I like to tell this story just to get conversations of racism going. So the moral of the story already, I'm going to give you the moral at the beginning, is that racism exists. Yes, it does. And now let me tell you what happened to me. As a first-year medical student, I was extremely studious and diligent. So I wake up on a Saturday morning. What am I doing? I'm studying. And some friends come over. So what do? We start studying. So we're studying together long and hard, and it gets late, and we get hungry, and I have no food in my apartment. And my friends, you know, that was typical. So they were like, all right, Camara, we understand. Let's go into town and find something to eat. So that's what we do. We go into town. We walk into town. We find a restaurant. We walk into the restaurant. We sit down. The menus are presented. We order our food. The food is served. Here we are eating. Not a very remarkable or revealing story about racism yet. But as I sat there with my friends eating, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now I've intrigued you, and you're like, Dr. Jones, what did the sign say? Well, what did the sign say? The sign said, open. So now I know I've lost many of you, so let me recap. Here we are sitting in a restaurant eating. I look across the room, I see a sign that says open. If I hadn't thought anything more about it, I would have assumed that other hungry people could walk in, sit down, order their food, and eat. But because I knew something about the two-sided nature of those signs, I recognized that now indeed the restaurant was closed due to the hour. But this restaurant was firmly closed, and that other hungry people just a few feet away from me, but on the other side of the sign, would not be able to come in, sit down, order their food, and eat. And that's when I understood how racism structures open, closed signs in our society. That racism structures, if you will, a dual reality. And for those who are inside the restaurant, at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on, because it's difficult for any of us to recognize a system of inequity that privileges us. So it's difficult for men to recognize male privilege and sexism. Hold on, I have to drink some water. Sorry about that. It's difficult for men to recognize sexism It's difficult for white Americans to recognize white privilege and racism. And actually, it's difficult for all Americans to recognize our American privilege in the global context. But those on the outside are very well aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign going on? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing to name racism. It doesn't even compel you to act, but it does equip you to act so that if you care about those on the other side of the sign, which is an if, but if you do, you could even talk to the restaurant owner who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door again? Let them come in. You will make more money. And oh, the conversations we could have. Or maybe what you'll do is pass food through the window. Or maybe you'll try to tear down that sign or break through that door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat, because you'll understand something about the two-sided nature of that sign. So I share this story often now to explain that yes, racism does exist. It is a two or multi-sided sign that is creating a dual or multi-faceted reality. And for those people who were born inside the restaurant, I once started a 3-hour conversation by asking a single question. How could people who are born inside the restaurant know something about the two-sided nature of that sign? Because there are many, many ways to know. What I just have to say right now is that, honestly, these days, in the past 3 weeks, this is the 1 month anniversary of the murder of George Floyd, but it's been about 3.5 weeks, people have been in the street, that something has happened, that the wind may have blown that sign so that people inside the restaurant have seen just a glimpse of the other side of that sign. One of my friends said, it's not just the wind blew it, a brick came through the window that caused the wind that made it blow. But whatever is happening, there are more people who are inside the restaurant who are recognizing and acknowledging there's a two-sided sign going on. This is great. This is progress. But it's not going to be enough for people to, companies and all to write statements, Black Lives Matter, naming structural racism, systemic racism. That is insufficient because the racism denial that's the baseline stance in this country is so seductive that if we do not do something besides just write a statement, we need to start acting. We need to start trying to take down that sign, to undo that lock, take the lock out, take the door off its hinges. If we do not act, then we are at risk 6 months from now from falling back into the sleepiness, the somnolence of racism denial. If we do start acting, we will not forget why we're acting, right? But if we just talk, we might fall back into that somnolence. So I owe you all a definition of racism. And when I offered the various definitions in our poll, I see that many people kind of agreed with me. But there are other answers too. And there are a lot of people who think racism is different things. When I talk about racism, I am first clear that I'm talking about a system. So I'm not talking about an individual character flaw, and I'm not talking about a personal moral failing, and I'm not talking about even a psychiatric illness, as some people have suggested. Instead, I'm talking about a system of power and a system of doing what? It is a system that does two things. It structures opportunity and assigns value. And when people talk about white supremacist culture as racism, well, that's the value assignment piece. So white supremacist culture underlies the assigning value in this country. So that's a huge part of it. But in its essence, even if we were to fix white supremacist culture, if we did not also address the opportunity structures that have been put in place and don't need an identifiable perpetrator now to keep on going, if we only fix the cultural piece without fixing the structural piece, then we still would be insufficient. So I define racism as a system of structuring opportunity and assigning value based on what? Based on so-called race, based on the social interpretation of how one looks, which is what we call race in this country. And the impacts of racism include that it unfairly disadvantages some individuals and communities. That's what we most often think of when we hear the word racism. But it shouldn't take us long to recognize that every unfair disadvantage has its reciprocal unfair advantage. So racism is also unfairly advantaging other individuals and communities. That's the whole issue of unearned white privilege that we hardly ever talk about in this country, because it makes some people, especially some white people, uncomfortable. And if you do feel uncomfortable, even right now when I say unfairly advantages or unearned white privilege, I used to say to my white folks, I'd say, shake it off, let's try to stay with me. I'm going to tell you some more stories. But I don't say shake it off anymore. I say, if you feel uncomfortable, what you need to do is lean in to that discomfort, because I have come to understand that for all of us, the edge of our comfort is our growing edge. But racism has another impact that we need to acknowledge, because even as it's unfairly disadvantaging or advantaging individuals and communities, racism is sapping the strength of the whole society through the waste of human resources. So not only do Black lives matter, for example, Black lives are precious. Black lives are genius. Black lives are leadership. Black lives are management. Black lives are creativity. Black lives are lovingness and generosity and all of these things. And when we constrain Black life, either slowly, perniciously, by not vigorously investing in the full, excellent public education of all of our children, because the blinders of racism have made some decision makers think there's no genius in the barrios or the ghettos or on the reservations. We can get along very well, thank you, without those kids, without recognizing there's genius in all of our communities. Or when we constrain Black and brown and indigenous lives by, actually being complacent with the disproportionate, the wholesale warehousing disproportionately of so many Black and brown men in our prison system, which separates us from human potential. Or when it's vigilantes or police officers charged with protecting the public, killing, shortening Black and brown lives. When we have this sapping,